All right, everybody. In this lesson, we're going to be talking about retained primitive reflexes and how they affect your child's sensory development and behavior. Now, the brain is designed to think of one task at a time. It's designed to think of what is in the here and now and detect what is happening around the child or ourselves. But during each task, the other areas of the brain need to be calm and still and be able to do their automatic function. That's part of the autonomic nervous system. So the one thing we're going to be focusing on is primitive reflexes. And when primitive reflexes don't integrate into the nervous system, we call those retained primitive reflexes. So when primitive reflexes are not integrated, the brain is in a constant state of stress. We call that fight or flight, sympathetic dominance. It's an easy example I like to use is if you're going through the woods, if you're on a nice hike and everything's nice and peaceful, and all of a sudden a bear jumps out and you have to run and get out of there, or if you feel daring, you can fight the bear. Well, what happens to the body and the nervous system is a whole new lesson in and of itself. But we just have to realize that a lot of things shut down and go in dormant mode in the brain and the nervous system and the body, and their only survival mechanisms kick in. Being able to reason, problem solve, detect what's going on in the environment and create an appropriate response. All of those things in the function of the brain is not able to work. So we're going to go into that a little bit more in detail. And here is what happens with our children. We see a lot of these things that we have on the screen here. They may feel overwhelmed, hitting, anxiety. All of these things are classified in that fight or flight response. Now, when the body is always focusing on these primitive reflexes that aren't integrated, they begin to create crutches or coping mechanisms to deal with these reflexes. They're not staying in that relaxed state, or we call it parasympathetic dominance. It's the opposite of that fight or flight. So when they are exposed to a sensory stimuli, or the environment is, in their eyes, stressful to deal with, because these primitive reflexes aren't integrated, they start to have anxiety. They start running away or having meltdowns. They can't focus because their nervous system is in the same state as it would be if they had to run away from that bear. When we have proper integration of the primitive reflexes, the left and right brain can communicate a lot easier with each other. The left brain is more analytical. The right brain is more artsy, artistic, creative. We need to have both. We need to have a good balance between the left and right brain. When the primitive reflexes are retained, again, it's very basic neurological mechanisms that the body has and needs during the first year of life, but if still hanging around, the higher centers of the brain can't function. The problem solving, the prefrontal cortex, the goal setting, the forward drive people should have, our children should have, is just not as sharp and in tune as it should be. So in my office, we do sensory integration therapy. There's a lot of information and a lot of things that we can do to help our kids, but we're just focusing on the top left, the primitive reflex therapy. The top right, the postural reflexes, that's another course you could learn up on. And the sensory system therapy on the bottom left, I have here the 5 sensory systems, but we also go into the interoceptive, the proprioceptive, and the vestibular as well. So we'll go into that a little glimpse in this slideshow, but I wanted just to show you that there's a lot that we can learn and do. And then again, the bottom right is just the metronome, more of the rhythm, and the side dominance, left and right coordination. But we're just focusing on the primitive reflexes. So these are the 7 primitive reflexes that we like to focus on in our office. There's a lot more, but these are the 7 heavy hitters. The first one I want to talk about is the Moro reflex. It's also called the startle reflex. It should integrate naturally within the first 2 or 4 months of age. Again, we're talking about the first year of life here with all of these primitive reflexes. So if this describes your child, if they're always on the go, if they're jumping around, they're aggressive, they may be aggressive to themselves, to other children, or maybe anxious, and it's just really hard for them to calm down, you got to look at this. You look at the Moro reflex. Same thing with being able to focus, or they're easily distracted. They're just go, go, go all the time, and it takes a while for them to calm down. Or they may be more on that flight part of it. They withdraw, they get timid, they try to hide underneath a table or a desk. Or they like to cuddle up into your arms, and they don't want to let go. The Moro reflex is one we need to look at. So the retained Moro reflex, it deals with a lot of different sensory systems, and I want to break that down a little bit. So the auditory sensory system, again, we're looking at loud noises. If they have a hard time remembering vocal instructions or verbal instructions, those are things we need to look at with the auditory system. Same thing with the tactile. If things distract them, textures or fabrics, that could mess with the tactile system. And visual, in schools we learn a lot through our eyes. Through a lot of the information we get is through the visual sense, so they may get tired, their eyes may get tired, and they may have a hard time staying focused. Vestibular, now the vestibular system is the sensory system that's found in the upper neck, inner ear area, the base of the brain, and this has a lot to do with knowing where your bearings are. A very easy illustration of that is being car sick. So if children like to spin or twirl, means they want that sensation. They're hyposensitive to the vestibular system. Or if they're hyper, they may get very dizzy or even car sick. And as a lot of us know, that's very debilitating. And then proprioceptive. Now this is, if you close your eyes, you know where your body is in space. Your brain always has a picture of your body and where it should be at. But some of our children that need to push into things, jump on things, push into people, give heavy hugs, or even not like to be touched, the proprioceptive system is off. They're not quite sure where their body is in space, and it's unsettling to them. Okay, now the Palmar reflex, when it integrates naturally, we'll see that integrate within 2 or 3 months of age. Now when it's not integrated, certain things that we may observe in our children are possible poor speech, different textures bother them, with their fingers, but also, again, tactile, so you're looking at different parts of the body as well. Handwriting for sure will be poor, sloppy, you can't color within the lines or do mazes, and they may love to touch everything or nothing at all. Now, when we're looking at different sensory systems that the Palmar reflex is associated with, tactile, again, it's spot on. It has a lot to do with that. So again, we're going back to textures, different clothes, fabrics. They may like to touch a lot of things, or a lot of different things may bother them, like wrinkles in their clothes. They may not like the car seat, different socks, tags, things like that. That's where we're going to be getting into the hypersensitivity or hyposensitivity to touch. If they may feel clumsy when they're trying to color or write, again, poor handwriting, just a lot of that fine motor control with their fingers, because it also affects the proprioceptive system or is associated with that. So we need to have our children be more aware of what their hands and fingers are doing. Now the next reflex is the rooting reflex. Again, that's the one that helps the child learn how to nurse. And that should integrate between 3 to 4 months of age. But when it's not, different things we may see is they may be very sensitive to their face, or they may love people touching their face. Sloppy eaters, maybe picky eaters. Again, it's associated with poor mental dexterity. The Palmar reflex and the rooting reflex are pretty closely intertwined. And then a very common one we see is the poor articulation of speech, because they don't have that again, the sense of awareness with the muscles in their lips or their mouth or their cheeks. Now, when it's retained, a few sensory systems that we'll see again is that tactile and that proprioceptive, much like the Palmar. So we're looking at, maybe loud when they chew foods. Different textures of foods may bother them. They may like crunchy foods or smooth foods, or vice versa. Again, proprioceptive, knowing how to articulate speech, how to form the tongue, where the tongue is in space, where the lips are, is just all that control that needs to happen as the reflex integrates. And we may see that they may like to put things in their mouth a lot, or have a hard time with anything around the mouth. So now the next reflex is the asymmetrical tonic neck reflex. That's a big word, or a lot of words. I like to just say ATNR. So if you hear me reference that, you know what that means. So this should integrate between 4 to 6 months of age. And when it doesn't, we're going to be seeing a lot of poor posture, poor muscle tone. This has a lot to do with the eyes, so difficulty tracking eyes or tracking objects with the eyes, and being able just to focus on hand-eye coordination things. Reading and writing, that's a big one when we're looking at the ATNR reflex. And when you may start seeing that these reflexes overlap, and that's so true when we're looking at the development of the nervous system. Another one may have, poor, body control with activities. Sports may be very difficult. Swimming, again, that full body, side dominance control. We see that in the ATNR reflex. Now, when it's retained, a few more we did touch on is, eye coordination, reading, and being able to track, if they skip lines when they read, and being able to go left or right, but then jump down to the next line. It's also tied to the vestibular system. As before, we talked about the vestibular system. If people may, or children may get car sick, they may love to spin a lot, or they may not like to spin at all. So that's one we have to look out for. And then also proprioceptive, that's going back to the sports, the coordination, sitting still in their seats at school, or they may have poor posture. So those are things that we see and observe in the retained ATNR reflex. So going on to the next one, the spinal galant reflex. This integrates around 3 to 9 months. This is when the back is brushed on one side, the body will flex. So we're measuring the core stability and core strength. And this is where we need to really watch for spinal scoliosis. The child may, or your child may not like tight clothing, or they may like the Under Armour clothing. They may love that deep pressure, that compression. And then they may be ants in the pants. Ants in the pants is when they're always moving around, wiggling. They're trying to gain that sense of awareness, so they're always on the move. And then by doing that, they're going to have a hard time focusing. And so that's a very easy reflex to test for, because we know when it's retained, it deals with tactile and proprioceptive systems. Talking again about the wrinkles in the shirts, and if they like tight shirts or clothing or not. And then body movement. Where is the body in space? Again, you're starting to see how things overlap. So we need to be able to screen and look at which one we need to focus on, mainly to help our child integrate these reflexes. Moving on to the next one, the tonic labyrinthine. This is the baby Superman, if you can remember back to the earlier one. So earlier slideshow that we did. Now with this one, there's debate on exactly when it integrates. Some say it's within the first year of life. There are some literature out there that say it's 3.5 years of life, or up to. So to play it safe, we just want to say 3.5 years and be able to screen for that afterwards and be able to help if this is hanging out. So if we see this baby Superman or the tonic labyrinthine still retained, The things we're going to be looking at, again, commonalities between these is the balance, posture, being able, getting car sick, hard time focusing, poor coordination. And this is a new one. You're looking now at rhythm and beat and timing. I see a lot of parents have this concern is when their children don't like rinsing their hair during bath time, or they may have a hard time going up or down stairs, because this is where the body starts to learn the front plane to the back plane, anterior to the posterior. And we need to help them be aware and trust their back as well as their front and have that coordination, that sense of awareness, so they can move their head and still know where they're at in space. So that goes into what sensory systems are involved. For sure, we talked about body awareness, especially when they're going up and down stairs, washing their hair out, proprioceptive, but visual is a big one. It's going to be able to have tummy time. When your child has tummy time, this is a big one where they have that strength in their back muscles. They come up and they're able to be in that Superman position, and they start to look around. They start to glance. And so we need this reflex for the visual sense and the vestibular, because the vestibular system is in the upper neck, and we get upper neck strength when we're in the Superman position. And then when we're able to have that proprioceptive body awareness, we start to have more control of going up and down stairs, movement. Your child may jump or push or be clumsy, fall down. And so those are things that we need to look for and screen for, and why we need to screen for it. So the next one is going to be the symmetrical tonic neck reflex. Now, symmetrical tonic neck reflex, or the STNR, should integrate within 9 to 11 months. This reflex is a reflex that helps our child or helps our children get ready to crawl or creep. On all fours, it's creeping in literature terminology. Army crawling is termed crawling. So if I'll try to differentiate going forward with that. So this is where we want to look for poor posture, because if it's not integrated, we'll see that in our child and our children. And then the arms and legs on one side of the body may have a hard time coordinating when you're walking. That's why crawling is so important. If we have children that skip crawling, then this is one we really need to look at integrating. We want to be able to see all fours crawling or creeping for at least 4 months during development to really help integrate this reflex. Messy eater, we may see that, and then being able to, again, focus and be able to look at more into the school age kids, look at the board, and then look down at their paper. Just that constant motion of the spine looking up and down. And a little more detail with this, if we see this retained reflex still, the STNR, we're going to be able to see a lot of the visual sense, vestibular, as well as the proprioceptive sense as well. And again, a lot of repetitive things here, but we're looking at different focal points with the visual sense, as well as being dizzy or wanting to spin a lot, or sense of awareness with that proprioceptive. So we're looking at, are they jumping a lot? Are they pushing a lot? Are they clumsy? Are they falling down? Are they always wiggly? So there's a lot of things that overlap, but we need to screen these. And that's why I focus on these 7, because they do overlap, but each one has a little nugget or a little individual focus that we like to look at with each one. So those are the top 7 reflexes. Now I bring in one of my favorite movies here, and this is just going back in time, because with the nervous system, we want to be able to help retrain it. So with primitive reflex therapy, it's like going back in time. We're retraining the nervous system. we are finding out exactly where the body derailed or the nervous system derailed from its proper development, and we're going back and retraining the body and retraining the brain, and it's called neuroplasticity. The brain is always able to rewire to some extent, and now to what extent, that's to be seen. We just need to be able to give the body the environment it needs to be able to learn as best it can, and the future is to be seen. So the future is what you make it. So what we do know is if we screen for these reflexes and we find some that are abnormal, we know we need to work on those. So there's a way to do that. So good old Back to the Future, we're going to be able to help our children. And you know what? To wrap this all up, we need to be able to go get our child back from the past. And so just keep working at this. This is just a start. Hopefully this is great information for you. I know when I learned this, it was just mind-blowing. It really brought everything together with how children are starting to have a stressful time growing up, so in the early years. So we need to be able to minimize that, and this is a great way to start helping their body and brain reconnect.